All right. Thank you, Kim. I will go ahead and get us started. Welcome, everybody. It looks like right now we have 5 hospitals on the line. Looks like Washington County in Georgia, Big South Fork Medical Center in Tennessee, Madison County Memorial in Florida, White Mountain Regional Medical Center in Arizona, and Mercy, and I'm sorry if I say this wrong, Tishomingo. You'll have to correct me when you're on, in Oklahoma. So I'm Rhonda Barkus. I'm the manager for the Small Rural Hospital Transition Project. Welcome to the second of our 5 Learning Collaborative calls. Thank you guys for coming back. We appreciate that. Terry Hill is also on the call, and he is going, in just a minute, I'm going to turn it over to him, and he is going to help facilitate some of the discussion about what strategy you all are thinking about looking at. Before I do that, though, I will tell you he's at the airport, and so Terry, again, we appreciate you joining us from the Minneapolis airport. The good thing is, I was thinking it's nice that you're not in the Atlanta airport because it's almost impossible to find a quiet spot there, but Minneapolis is a lot quieter, so that's good. For you guys on Adobe Connect, you see there is the team that is working with you, Terry, myself, and Kim. And this is a reminder of the Learning Collaborative objectives that we discussed actually last month, that we will be working towards helping you guys to learn how to create a strategy map and balance scorecard, and then how to use those tools to really be able to show value for your hospital. The agenda for today, in a moment when I turn over to Terry, we're going to ask each of you guys to share one strategy that you think that you are going to focus on over the next few calls. We know that, with the strategy map and balance scorecard, the strategy map actually includes a lot of different strategies that you could identify. What we're going to ask you to do, though, is just to make it more manageable. We're going to ask you just to share one strategy, and then each time when we come back, you will talk about what you continue to do, like with the balance scorecard for that strategy. So that way you'll just kind of track with one strategy throughout all the rest of the 3 calls remaining. So Terry will have you share a little bit about that. Remember, last month we also encouraged you guys to take the self-assessment and see if that gave you any feedback about a strategy you wanted to address. Maybe you had a previous strategy map that you were still pulling some information from that you were going to bring forward. Maybe you have a community health needs assessment that helped you to identify strategy. But again, we're going to ask you just to focus on one throughout all 5 calls. So we'll have that discussion in just a moment. Then we will talk a little bit about the overview of the strategy map balance scorecard so you can see what that looks like. Then we will talk a little bit about how to really start using that one strategy that you have and how to start creating a strategy map. And then we will talk about kind of next steps for our next call. All right, so I am going to pass it over to you, Terry. It looks like we still have the 5 hospitals on the call. Would it be easier, Terry, if we just kind of went down the line and folks would be unmuted as they come up in line?
Yeah, that's fine if we can just use the order that we have on the sheet here. That would work great.
The one on the sheet, okay, we'll do that. So the first one on the sheet would be Washington County Regional Medical Center in Washington County, Georgia. And Antoine, are you on the call?
Rhonda, I'm just going to take a moment and unmute all the lines. I think that'll help us.
Yeah.
Okay.
Good idea.
There we go. Okay, so everyone is unmuted.
Can you guys hear us now?
Yes. Yes, we can.
Okay.
Thank you.
To join David, this is David Flanders. I'm the Chief Operating Officer here, along with Heidi Coffey is our Chief Nursing Officer.
Okay,
Great.
David. Okay. So David, so the questions then that we're going to ask you guys to share a little bit about is, what is the one strategy that you think that you are going to want to focus on over the next few calls? And then what tools and resources did you guys use to identify that strategy? And then are there any additional information that you need to consider or finalize that one strategy area? So what are you guys thinking about?
Well, what we're considering is to start it off on our care coordination program is to start to pilot a care coordination program within our facility with our own employees first, and to work on wellness programs and follow up for chronic illnesses.
And I mean, it sounds like a couple here, and there's nothing wrong with having a few different strategies. If you were going to say which one would be the most important at this time, which would you say?
Probably the wellness program would be the easiest
Okay.
to start with. What we want to work toward is the overall stand-up of a care coordination program, and just starting internally. We feel like we can do the pilot internally and then move it out to the community.
Yeah, and that's a strategy we generally recommend. Unless you have a ton of resources, time, and energy, it generally really helps, particularly in the wellness program, to begin in your own facility. And besides, helping guide you with a strategy map and a balanced scorecard, we also have access to a whole lot of resources where, we'd be happy to give you information, models, et cetera, on both care coordination and wellness programs. So you don't have to reinvent the wheel here. There's a lot of really terrific work going on across the country. And my assumption would be then that you're not in an accountable care organization at this time. Is that correct?
We are not, but we're in the process of joining. We will be very shortly.
Okay, terrific. And again, I'm just coming back from the National Rural Policy Conference, and we had a national summit meeting on early results of the rural accountable care organizations. And what I can tell you, it's very encouraging, and again, we're happy to share some of the results with you folks as well. Because one of the things our center does is really try to track where are the value models developing across the country, what are we learning from them, and what can we help other rural hospitals prepare for this movement into value population health. So it seems to me like you're right on target. Thanks.
Okay. Anything else on that, David, that you want to mention?
I don't think so. I think that covers it.
Okay. All right. Thanks. All right. So the next one on the list that we have is Big South Fork Medical Center, and that's Jennifer. Jennifer, I'm not sure that you were on the call last time, but hopefully you've had a chance to listen to the playback. What are you all thinking about doing? And also, if you'll go ahead and introduce yourself, and if anybody else is in the room with you.
Okay, I'm Jennifer Searcy. I'm the HR manager here at the hospital at Big South Fork. We are located in Oneida, Tennessee, a little county called Scott. I have in the room with me 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 other managers from various departments.
Okay.
We're actually working on this as a group. And what we're going to start working on first is increasing our radiology services.
Jennifer, so you don't have one now. Do you have a strategic plan? Is it a part of your strategic plan right now? Jennifer, are you just beginning to explore that strategy?
So we actually have a radiology department now. We're just wanting to increase our services. We actually reopened this facility August of 2017. So we're wanting to increase services for our community, our patients in the community, and the surrounding counties that actually come here. So we're really wanting to focus on first in the radiology department is increasing and doing stress testing.
Hey, do you currently have a strategic plan? Is it a part of that, or we're just wondering what?
Yes. Yes.
I don't know if you heard
I
you.
said, did you hear me?
No, no, we didn't.
Oh, I said, yes, we do.
Oh, okay, good, thanks. Anything else you want to say about that? Anything we can help with on the interim basis here?
No.
Okay.
Thanks.
Hey, and Jennifer, this is Rhonda. So you said that you have a strategic plan. Is it something that you all are in the process of updating, or is it fairly current?
We're updating it.
Updating it. Okay, perfect. This will be really helpful to you then. Great. Okay, good. So increasing radiology services is kind of the strategy you'll focus on for the Learning Collaborative. Perfect.
Yes.
Okay. All right. And then Madison County Memorial Hospital, Tammy Stevens in Florida.
Hey, this is Tammy. With me today, good afternoon, I have Lori Evans. She's our foundation director, and she does our research for our grants and grant writing for our hospital and public relations. And Patrick McGee, CFO. Cindy Burnett, Human Resource Officer. I had the Chief Nursing Officer in the room, but she stepped out, and she possibly will walk back at any time.
Okay.
So what we basically have decided as a team, based on the surveys that were completed, we identified our area of focus is going to be on data-driven decision-making, what data can look like as we connect to a dashboard, who needs to collect, monitor, and report, who needs to receive the data internally and externally, and to use the data to drive all decisions that the hospital makes to make the data make sense to various stakeholders. The area that we really were zeroing in on was the measurement, feedback, knowledge management, impacts, and outcomes. And we kind of identified that would be the greatest impact on our organization since it drives many of the other indicators. We looked at our 2017 China and our implementation strategies, our 2017-2020 strategic plan, and then the hospital-wide quality improvement team activities. And we have been without a quality manager since October 2018, which has caused us not to be able to move forward as intended in some of those areas. So, of course, now we're excited. We have finally found a quality manager, and she will join our team in March. One of our concerns is our electronic record information system and what might be required to be able to integrate data into a dashboard. So we're engaged in IT vendor and clinical IT support to kind of understand what our capabilities are with our electronic health record to be able to integrate surveillance systems into a dashboard.
Okay.
Of course, what we find is communication, of course, is going to be key. We want to ensure broad communication to seek input from the entire workforce, medical staff, volunteers, and our hospital board, and to continue to provide ongoing education and public display of the impacts and outcomes hospital-wide to our community.
Well, you've hit all the pieces here, Tammy, and that's precisely what the balanced scorecard and the strategy map are basically designed to do. First of all, to really generate data-driven decision-making. And we've been using a scorecard in our organization for years, at least a dozen years. And it really does tell us what are the most important things we need to be measuring. And what I'd caution you, so many rural hospitals try to put too much onto the scorecard. So think through, it's like probably you don't want more than, well, the most I ever recommend is maybe 20 different measures or you can start out with 5 or 6 or something of that nature. But that's going to help you chart your progress moving forward. Second thing, as you said, is it really is a good communication vehicle. And our board of directors basically towards the beginning of every agenda looks at the balanced scorecard. And so it's communicating what's important to us, and it's communicating our strategies, and it's giving the board an idea, rather than the same old financial stuff, et cetera, giving them an idea perhaps of how they might be able to help moving forward. And then it also, the other challenge you've got is driving your strategies down to your department heads and ideally throughout your organization. And I've got several hospitals we've worked with that will put their balanced scorecard right on the wall, and in the break room or someplace I've even seen scorecards in the patient waiting rooms as soon as you come in the door. So I think it kind of hits all of those pieces, and your EHR should be able to give you some data and information to put in there as well. So it sounds like you're on the right track, and hopefully we'll be able to help here.
Thank you, Terry.
You're welcome. Anything else? Any questions? Okay. Rhonda?
Did you have anything else, Terry? Or Tammy? Sorry.
No.
No, thank you.
No? Okay. So the next hospital on the line is White Mountain Regional Medical Center in Arizona. I know last month Bridget was on the call, so not sure is Greg there or who's speaking for White Mountain?
Good morning, good afternoon. This is Greg Wise, I'm the CEO. In the room we have David Miller, our IT director, Tracy Nelson, our clinic manager, Larry Turrell, our CFO, and Sammy Finch, our CNO. What we did is, as a basis for where we needed to go, we did the self-assessment for transition planning. And the one thing we came up with was under the category operations and processes, and specifically uses technology appropriately to improve efficiency and quality. And under that, focus on the patient care experience and quality of care. And basically, under the financial guise of maximizing revenue and controlling costs.
Greg, this is Terry. So good to talk to you again. I've been to Greg's facility and to Tammy's for that matter. So it's great to have you both on. Greg, you also mentioned telemedicine here. Are you looking at telemedicine solutions as well?
Yeah, and that would go under that category, telemedicine solutions.
Yeah. That's one of the things that I can tell you coming back from the policy conference. The head of Dr. Azar, the head of the Department of Health and Human Services, basically kept hitting telemedicine over and over and over again. I mean, if there was one theme coming out of there, it was we're moving big time into telemedicine. And there have also been new codes, new telemedicine codes that are just coming available as the first of the year. Telemonitoring, for example, in the home. So if you guys want to, we can tell you what the new telemedicine codes are. We can give you some idea about how what the codes are. Just some basic applications here as well in terms of where telemedicine. Like I said, though, everything is pushing in that direction. We're seeing the private payers, the Blue Cross Blue Shields of the world, now building it in. We're seeing Medicaid moving dramatically in this direction, and slowly but surely Medicare is making this transition as well.
Okay, good. Terry, what we may do is schedule a call with you before the next session, just to make sure we're on the same, going in the right direction.
That'd be terrific, Greg. I'd be happy to do that. Just you can arrange that through Kim, or you can call me directly, whatever would make. I think my number's on on the line here towards the end. So yeah, do call me and if anybody else is interested in any of the resources that we're talking about here, just let us know.
Okay, excellent. Is there anything more? And actually where we are in the strategic planning process, we had a strategic plan in 2016 and coming up to renewing it. So we're using the balanced scorecard approach to do that.
Terrific. Yeah, you just mentioned another really good thing in there, Brian. If you use your balanced scorecard, you can make sure that your strategic plan is balanced, so that you're looking at not just your financial and your quality outcomes, but you're looking in at what kind of preparation, what kind of skill set, what kind of technology are we needing, et cetera. And I've always found that when you use the balanced scorecard as kind of a framework, a general framework, it doesn't have to be totally specific. It really helps ensure that you're taking a 360 view of your environment.
And I think that was the usefulness of the self-assessment, is that really it didn't key in on financial metrics or things of that nature. It really talked about the intangible resources and other types of things that need to be considered.
Great. Terrific, Greg. Yeah.
Okay. And Greg, this is Rhonda. So for the sake of the next 3 calls, you had mentioned several things: patient experience, telehealth, some financial issues. What is the one strategy that you're going to use that will be the common thread throughout all of these? Are you going to focus on telehealth or something different?
Telehealth.
Okay. Well, it sounds like that's perfect timing, knowing that Terry's your man. Okay. All right. And then Mercy. Lori McMillan, I know you're on the call.
Yes, I'm here with my Director of Nurses, Shelley, and then our lab manager, Kelly, and our ED coordinator, Matt. So I think our overall area we want to focus on is increasing utilization of our services, inpatient and outpatient. We are a pretty small facility, but because of the age of our facility, we're trying to work on getting a new facility. We've just got to get our census and our utilization of everything up. We've seen a little bit of growth this year, but we don't have a strategic plan, and so I want to develop that so we have a map for where to go.
That sounds good, Lori. Utilization, again, is key here. What we know is that we're going to see an inevitable decrease in acute care census. It's inevitable. It's going to go down, but we need to maximize that to the degree we can on an individual hospital basis. But one of the issues that almost all rural hospitals face is this out-migration for care. And over the years, we've discovered that a lot of it is just that the people in the community don't realize the services that you've got available. So, in fact, we had a really pretty great conversation about this very fact, about how do we help rural hospitals. And this past week kind of address this very thing so that they can capture revenue, kind of, it's marketing, but it's not the traditional kind of marketing where you're going to put up big billboards or television ads. There's just a variety of different ways that you can go about doing this. And, we can certainly share some of the resources and ideas with you as well, but that piece, it's always astounding, I can tell you, when you really get the numbers about how many people leave for services that are available locally. And of course, some people, it's like, I want to go to a bigger place, or I have grievances against my local hospital. I mean, that's just so common. But there's just a ton of, we just don't know what services are available here. They don't know that cardiac rehab may be, et cetera. And so we've got to work smarter and more efficiently in terms of getting that word out, and then, making sure our folks are kind of inspired If they know it's here, then we want them to come in and use our services. And of course, outpatient services are really key here as well. So, is there anything in particular, Lori, that we can do? So your basic looking on your strategy map is to kind of grow. My assumption would be to grow revenue through increased utilization of the services. Right?
Yeah, and I think we need a mix of increasing volume, but also just being operationally efficient and figuring that out. So.
Yeah, I would agree. It sounds good. Anything else, Lori?
No, I think just familiarizing myself with the strategy map. I may need someone just to help me kind of walk through how that works in terms of filling that out a little bit specifically. But
Lori, I'd be happy to do that, and I can also give you suggestions, or I might be able to help a bit with as you're putting your strategic planning in place in that regard. But why don't you schedule some time, and you and I can, or you and whoever, you can put a whole group together if you want. I'd be happy to talk to you about it.
And who am I speaking with?
This is Terry Hill.
Thank you. And Lori, we'll have Terry's contact information at the end, and absolutely you can call or email him and set up some time. So okay, and then we're about to actually spend a little bit of time talking about the strategy map and a little bit about how to fill it out and give you guys actually an example from an actual hospital we worked with a couple years ago and how they did that. But I'm really excited just hearing the different ideas for your strategies because everything is very different. And so it's going to be fun to listen to what happens in the next several calls as you guys drill down on this. So we've got create an employee wellness program, increasing radiology services, using data to drive decision making, utilizing telehealth, and then increasing utilization of services. So this is good. And I think there will be a nice opportunity as well to learn from each other. Okay. So what you see on the screen now is an example of an actual hospital and their strategy map. Terry had mentioned that the nice thing about this is it keeps it very balanced. And so you can see that the strategy map is actually divided into 4 sections: financial, patients, community and partner, internal processes, learning and growth. And then across each row you can see for this hospital what they decided to focus on, whether it was optimizing reimbursement by looking at their revenue cycle, continuing the development of their board, improving patient and family engagement. So you can see they got very specific in these different areas of the actual items that they wanted to focus on. And so my guess is that for many of you, the things that you have mentioned today will be one item in one of those categories. So this is the big strategy map where they identified, and you can see 1, 2, 3, 4, 8, 9, 10, 11, 12, 13, 14. They have 14 strategies here. And we will come back to that in just a moment and talk about how to do that. But that is going to be the basis for today. These other pieces are just to show you what will come later. This is going to be in call 3 and 4. And that is creating, once you have your strategy, then creating the balanced scorecard, which is how are you going to measure this and show progress. And so what you can see here is that each of these 4 areas on the side then have their own balanced scorecard. And so each of the items that they have identified in the strategy map now has its own row under the balanced scorecard. So this one right here is for financial perspective. And you can see they are talking about, optimizing reimbursement, looking at revenue cycle. And so you can see how are they going to measure that. They're looking at days cash on hand, discharges not final bills. You can see what the target is going to be, what they're trying to move towards. and then the frequency of the data collection, and then who's going to be responsible for that. So that's their balance scorecard just for the financial piece. The next piece is the patient's community and partner perspective. This is where they're looking at patient-family experience, looking at HCAP scores. And again, you can see down the line the different pieces of the strategy and then what they're going to do to measure it, the definition of the measure, the target. So these are just some examples. And you guys have the slide deck, so you can always refer back to this. Then the next part is the internal processes. They did the very same thing, took each strategy and just follow through with what the measure is going to be. And then lastly is the learning and growth area. And so you can see what their plan is for each of those strategies. So walking away, they have 5 slides of strategy map and then the balance scorecard that matches each of those areas of that strategy map. So again, just wanted to show you guys this as an example. I'm going to stop for just a minute before we talk about actually how to use the strategy map. Kim's going to put up a polling question just to see how comfortable do you feel right now in this moment as far as how to do a strategy map. We're about to talk about how to do it, so if you're not totally confident, that's okay, because we're wanting to kind of see where you are now. So if you would just take a minute, so concerning your knowledge on how to identify your focus for strategy map, are you confident, somewhat confident, neutral, somewhat unconfident, or unconfident? So if you will just take a minute and key in your vote for that. Okay, I think that's everybody. Thank you, guys. So it looks like somewhat confident and neutral and are the winning answers. So then to talk a little bit about the strategy map, and Terry, I'll go ahead and talk about some of this, and then if you will just jump in, if that's okay.
Right, that'll be fine, Rhonda. My plane's been delayed, so.
Okay, all right. And I knew you weren't on Adobe Connect, so I thought I'd just talk through the slides, and then I'll pause and let you respond as well. So the strategy map, you know, the key to that is to really to think of it as a communication tool. So it's going to graphically, as you guys saw, it's just a very nice, clear, succinct picture of the organization's strategies. It really helps, the way it's organized, it helps you to see how the strategies relate to each other and the categories within which they fall. And then it frames those key concepts and then begins to guide the balanced scorecard, the actions you're going to take to actually operationalize the strategy. So it's such a nice, complete picture where it's not just, hey, let's do this strategy. It's really diving down into, okay, what are we going to do to actually move this strategy forward? Who's responsible? And how are we going to measure that? So it's just a very nice roadmap. So a couple years ago, we had a summit, and we created the guide that we had shared with you guys last time, which we said was kind of like the Bible for how to create your strategy map and your balanced scorecard. The nice thing about the strategy map is, and if you've started to look at it, you will see that it's actually already populated with some suggestions. So you're not having to start from ground zero. So for instance, if you're wanting to look at revenue cycle management, there may already be some suggestions there on measures for that. So it was really already created and researched by a lot of experts across the country who said, hey, these are some really good measures that you might think about using. So that's what we love about it. It gives you something to start with, but since it's in a Word document, you can edit it entirely. So you pull up the strategy map template, and you just begin to make it up your own. You just edit as needed. So it's easy to use and then adopt and navigate. Then it's easy to communicate to your board of directors, medical staff, and the frontline staff, because as you all saw, it's pretty simple to follow. And it's really easy to implement at the departmental level to begin to continue to align those actions. And so, for instance, you can share your strategy with your department heads, and then they can begin to figure out, okay, what are the things I need to do to support this strategy to move forward on the balanced scorecard. So again, very simple and straightforward. This is actually the visual of our strategy map template. So you can see on the left-hand side, there are the different areas that we had talked about earlier. There are several examples of strategies that you might consider in there, but again, you can just delete those, copy in your own, and totally make this your own. There's an area down below to put your mission, your vision, and your values, because certainly we want our strategy to always align with the mission, vision, and values. So it's always helpful to be reminded of that. And then again, the nice piece is it creates balance so that we are not so focused on just the financials, but we're also remembering the importance of those internal processes, or the learning and growth, the patients, partners, and communities. So all of those, the strategies that you all mentioned in your check-in would obviously go somewhere in here, and you would begin to kind of craft that. So I think that's, yep, so I'm going to pause there and open up. Terry, what kinds of other thoughts do you have about just doing the strategy map? Because I know one of the things that Terry, Kim, and I talked about after our last Learning Collaborative is we know that this can feel sometimes overwhelming because, I mean, right here there's potentially 16 different areas. That's why we really want you to just focus on one. And because if you can really get good at creating a good strategy for one, and then we will do the balanced scorecard for that one, then it'll be easier to actually apply it to other strategies you might have. So now I really will be quiet, Terry, so you can jump in.
Okay, thanks, Rhonda. Let me give an example. So let's take Greg's case of telemedicine. So one of the things we would look at, you want to look at all four dimensions. And so if we were going to put in a meaningful, an excellent telehealth system or telemedicine system, what would we have to do in learning and growth? There would obviously be some skills we'd have to develop here. We'd have to basically maybe train our staff. We'd have to have our physicians on board. They might need some education, for example, because we're seeing a lot of physician resistance, I think, for no good reason that we can find, but just simply that it's new, and particularly some of the older physicians, there's some pushback at times here. So we would want to look at that strategy. There would be an education component. There might very well be a skill building piece. It could be that we also need to hire somebody, maybe a technician here as well. So those pieces would all be under learning and growth. It's like skills, people, and places. That would be where are we going to put this? Okay. Under the process side, we'd say, okay, if telemedicine has very different processes than other types of medical practice. So, in essence, we'd want to look at those processes and decide how those telemed processes were going to work out. It could very well mean that we'd have to change our patient flow patterns a bit, maybe into a telemedicine room, et cetera. But we're thinking that through under this basic theme of telemedicine. And then then we go down to community partners and patients, and we think through, okay, who would we need? Telemedicine is going to require a partner out there. So maybe it's somebody in Greg's situation at White Mountain. Maybe there's a hospital in Phoenix that would want to develop some sort of linkages. It could be that we are going to need to prepare our patients. We're going to have to maybe educate our patients in this sector as well. So we're thinking through holistically about this strategy. And then finally, in the financial part, we have to figure out, okay, what is the financial payoff here? How are we going to actually make this work for us from a payment standpoint? Are we going to have to access new codes, which may get us all, it just kind of completes that full picture. And then with every one of those areas, there would be a set of measurements built in, or it could be how much education is it going to take, how many people are going to be educated in the learning and growth, what are the processes that we're going to put into place, specifically, and find a measurement piece on that. We could look at setting a timeline for getting that partner on the telemedicine side, and then finally, we can really start looking in at, okay, exactly how many dollars, or how is this going to affect our bottom line, et cetera. So it's all flow from one to the other. We actually have our balanced scorecard tipped upside down. And for nonprofit organizations, that's something to consider. That in other words, if we prepare our staff and have the right technology, if we have the right processes in place, and if we have the right partners and we educate our patients, then we are going to make out very well financially. Rhonda, I'll turn it back to you.
Okay, thanks, Terry. Appreciate you doing some clarification on that. So in thinking about then the next Learning Collaborative meeting, we will be having you guys bring back kind of what you've begun to craft around doing the strategy map with that idea, the idea that you had shared. I want to stop for a moment though and open it up, see if you guys have any questions about how to do this. And again, we just want to focus for this next call on the strategy map only. We'll do the balanced scorecard next time, but right now it's just the strategy map. So questions about how to do that. You can certainly speak by phone, or you can also type your questions in the chat box if you would like. Any questions?
This is Greg Waz at White Mountain Regional Medical Center. We started to develop some of these on our own, and how much detail do we get down in? Because we were getting into some pretty specific levels of detail. Does that happen in the strategy map phase, or then do we do it somewhere else?
Yeah, Greg, the strategy map shouldn't have a lot of detail on it, because remember, it's going to be a communication tool for you. The detail can come in kind of in the strategic plan or the plan that would accompany it. So, the details are important. Exactly, here's how we're going to do it in that regard. But that can accompany the strategy map. It's the detail provided. If you've got it done electronically, you could drill down into every one of those specific strategies and see the details as well. So it's just keep it relatively simple. Not a lot of words on it. We don't suggest more than a handful, basically. Develop telehealth skills. Now that's deliberately vague, and it requires the details that you're talking about here. But the map itself is just reminding us that we're committed over this next time period, and for us it's like on an annual basis, to building the skill set of our staff here. And we have some targets. This is what we're moving towards, and all of that can come as an accompanying piece of the strategy map. And if you use the strategy map as the face of your strategic plan, it simply communicates what you have in mind for the coming year.
Oh, that's perfect,
Terry,
Terry. Thank you so much.
This is Rhonda. So it sounds like the strategy map is the what, and then they would do an action plan, and that would be the how, and that's where they drill down to the details and what they're going to actually do to reach these goals. Is that accurate?
Absolutely. Yep.
Okay. Okay.
And that's really good for the board. I mean, the board isn't going to want all the details. They're going to assume you've got this worked out, and that's where you build it into your strategic plan. But in essence, the board sees a skill building on it, and they may say, well, what's your progress on that? And you would have a number there that you would be measuring your progress and moving into that. And it also, you know, a lot of times boards will tend to micromanage on the things they feel comfortable with. And what we found with the scorecard is that it really does open up kind of the board's participation, and I think their understanding about the fact that it takes more than just the bottom line. You know, you're going to have to invest some resources here, and I think that's another probably not. You know, I think an important sort of a benefit here is they're realizing that if we're going to have a great telemedicine program, that we're going to have to make some investment here. But our plan is that it's going to pay off for us on the bottom line.
Okay. Thanks, Terry. Other questions? No? Okay. So then moving on, just real simply for the next, in preparation for the next Learning Collaborative, which is in March, go ahead and start working on your strategy map template. Again, just on the one item, well, you're free certainly to go ahead and start doing other items, but what we would like for you to bring back next call is the one item that you identified today and what you began to craft that will go under that piece. So that will be the preparation for the next Learning Collaborative. And again, remembering that there is your the value-based strategic planning guide is the resource that includes all of the templates, the how-tos, and it is online and it's on our website. And then lastly, just to remind you, here are especially Terry's phone number and email. So you guys feel free to call him and set up an appointment to have some one-on-one coaching to talk through what you're thinking about, get him his reaction to some things, or if you feel stuck, instead of continuing to try to sludge through it, go ahead and give Terry a call, because again, he's got so much experience with this that sometimes what feels hard, like for me, if it's not my specialty, Terry can just kind of point out the answer pretty quickly. So I really encourage you guys to reach out as you need to or as you want to. So Kim has put the last post-education vote up here, and so this is, again, just now that we've talked a little bit about how to do that strategy map and how to begin to craft that. Can you just identify whether you're more comfortable? So either comfortable or confident, somewhat confident, neutral, somewhat unconfident, or unconfident. So just if there's been any change in your understanding of how to do the strategy map. Okay, and while we were finishing up, any last comments from either Terry or Kim or any of you all who have joined us today? Anything else that you just want to ask or comment on before we wrap up? Nope. All right. Well, we really want to thank you all for joining us today, and thank you for participating, and can't wait till our next call to find out what kinds of things you begin to identify for your strategy map. And then the teaching piece for next time is going to be then how to start creating your balanced scorecard from that. So that will be the next piece. Hope everybody has a really wonderful day, and yes, it's Thursday, so I hope you have a good weekend. And Terry, I hope you get back to Duluth very soon and that your flight doesn't get delayed any longer. Bye, everybody.
Have a good afternoon.
Thank you so much.